Hi everybody, my name is Banji David and today I'll be showing you how to set up an IV infusion together with a piggyback setup as well by Gravity. Okay, before anything else, I just want to point out some important things to remember that must remain consistent throughout the whole video, and this applies to real life situations as well. Okay, so first of all, go ahead and washing technique. Exiting and entering patient's room, donning and doffing of gloves. Make sure you do some good hand washing. All right, next is our patient privacy. Give privacy to your patient for every procedure. Third, very important, once you receive an order, before administering any medication to your patient, check your 6 rights of medication. And what are those? First of all, is your right patient, 2 patient identifiers, your right route. For this one, it's an IV, the right time, the right dosage, and the right documentation. Okay, so next point would be to check for patient allergies. Ask your patient, sir, ma'am, do you have any allergies? Food, medication, latex, and then cross-check with your MAR. Okay, and last but not the least, just good nursing practice is to inform your patient of the procedure you'll be doing. Let's say you gather all your equipment and you go into the patient room, the patient refuses. Work efficiently. You won't only have one patient for the day, so you will waste time and effort. So make sure you document on that refusal, and then reorient your patient on risks and benefits, and then inform your patient the MD right away for that refusal. So let's start. Let's say you get an order for 1,000 mLs of normal saline at 150 mLs per hour. So just to visualize that, here we go. This is your formula for volume over time times the drift factor, which gives you the flow rate, which is GTT per minute. So 150 mLs divided by 60, which is minutes, times 15 gives you 37.5. And then you round that up to 38 GTT per minute. Why are we doing 15? So let's go to our tubing. All right, so this is your primary tubing. All right, sorry, this should be capped. Primary tubing, you'll see a drift factor of 15. So this tubing is actually a macro drip tubing. So macro meaning it's usually used for general IV infusions. It's larger, usually used for 100 mLs per hour or more of fluids. And the micro tubing is used for pediatrics. It's more precise, it's smaller, usually 60 GTT per mLs. So that one is smaller and more precise rate for medication. So for this one, we'll be using macro. So here are the parts. This is your tube, and you have your spike end. So this goes to your medication, the spike, your drip chamber. This is where you'll be seeing your drips. Your tubing, of course, your roller clamp, which goes up and down, which rolls. This is to regulate your drips. Okay, make sure you regulate it carefully. And then you have your Y site. Why? Because it looks like a Y, I guess. Here's your tubing, and this port is for extra medication to be given to your patient, which we will use later on. Okay, and this is your adapter end right here. Keep it clean, keep it sterile, keep it capped until you're ready to use it. Okay, and of course, just show you real quick your fluid. Let's say this is normal saline, 1,000 mL. So we will not be using this port. This is for extra medication that needs to be mixed, if needed, to your fluid. And this is for the patient. This is what we will be using. So, all right. So let's start. We have our 38 drops per minute to be infused to your patient. So you have all your equipment. You go in the patient's room. Knock, knock, knock. Hi, can you please check your patient identifiers, your name and date of birth? Thank you. So as we talked about earlier, Mrs. Smith, are you ready to infuse this medication? Patient says yes. Hand wash when you entered, and then hand wash, don your gloves. So now, first things first, we have to prime your line, your tube. Priming meaning we are removing air, and we are filling the tube with fluid. We don't want any air, we want the fluid in your patient. So how do we prime? Before anything else, make sure that your clamp is off. Okay, off. See, it's not moving, so there's no fluid that's going to run. We don't want to waste any medication once we spike it. Okay, so now we are going to spike our medication. Remove the cap, throw, twist this part to open. We are spiking all the way through. Okay, once that is done, we are closed. You don't see any medication flowing. Okay, so now we are going to hang this like this, and make sure you have a receptacle near you. Do not put it on the floor. Do not drip it on the floor, make a mess. All right, so we are still capped. So depending on some facilities, for the purpose of this video, I'm going to remove it once we start priming. Keep the cap. We're going to recap later on. Okay, so now fill your drip chamber halfway through or 2/3. Do not fill it all the way through. You won't be able to see your drip. Okay, there you go. So now just give it a few squeeze. So now we're going to regulate slowly. We're just going to fill the tube with the fluid. So once you get a few drops out from this end and you see your line is clean, there's no air, so we're good to go. You are primed. Make sure there's no air on your tubing. If there is leakage, stretch it. Just make sure there's none. Alright, so we fill off right here. Turn it off. Tap it. Why? Because at this point, you still need to clean your patient's hub. Do not forget, before attaching, clean it 15 seconds, let it dry, and then flush your patient's line, IV site. So after that, you can now connect, remove, connect it to your patient. Okay, we are still off, right? Just want to remind you. So now, we are going to count the drips for 1 full minute. Usually you have a watch, you time the gear 1 full minute. Okay, for the video, I'll be using this timer. So you have your roller tap. Slowly release and count 38 drops per minute. 38 drops for 1 full minute. Make sure you're not using too fast, so because you don't want to overload the patient. Okay. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. Regulating. Okay, we are regulating 6, 7, 28, 29, regulating 30, 31, 32, 33, 34, 35. We are regulating still slowly 36, 37, and 38 drops per minute. Okay, so let's say that is already infusing. Your patient 38 drops per minute. So now make sure you check on your patient. There's no adverse reactions. At least stay there for 15 minutes. Document on the procedure. Make sure you do some good hand washing technique. Inform your patient. If he feels any adverse reactions, inform you right away. So we're removing gloves, hand wash. So now you get another order. You get another order for antibiotic that needs to be infused to your patient. So make sure that you have the right medication. Do your patient's rights. Again, cross-check with your MAR. All right. And your order is amoxicillin, 250 milligrams in 100 ml of normal saline over 15 minutes. Same formula. Volume over time times the drop factor, which gives you the flow rate. So that's 100 ml over 15 minutes times 15. All right, it gives you 100 GTT per minute. Okay, just a reminder, if you're given hours, which not for antibiotics, and for other fluids, usually, remember to divide the hours by 60 because we want the minutes. So divide by 60, then you multiply by 15. So for this one, we're giving 100 GTT per minute. You'll be counting that as well for 1 full minute. Okay. And so now let's go to our equipment. Make sure you have a secondary equipment. This is for our piggyback. All right. This will be for antibiotic. Why make sure secondary set? Because it's different. It is much shorter than our primary line. There's no white site. You're not injecting any other medication through this. And although the ends are the same, spike end and the adapter end, and you have a hanger for later. Okay, so now we have our fluid. Same thing, 2 ports, one for medication and one for your tubing. Okay, so same thing, we're going to prime. We're removing air, filling it with fluid, and make sure before you prime, again, the roller clamp is off. I mean, it's clamped. Okay, the roller clamp is clamped. Okay, so, and still sterile, remove for the spike it, make sure, again, also make sure your fluids are compatible, okay, before administering to a patient. Not cloudy is what it's supposed to look like. 6 rights of medication. And then fill the drip chamber halfway through. Make sure you still see your drips. So it's not dripping yet, but it's close. So we are now going to hang this. And then we get our hanger. This is still closed. We're going to lower down your primary fluid. Why? Law of gravity. Higher one gets pulled going to your patient first because we want that to run. After that runs, your primary fluid finishes off. Okay? So right now, this one is higher, your antibiotics, which we need to infuse to your patient. But for first, we are priming. So remove cap, move our roller clamp, slowly open it, fill the tube with fluid, no air, no bubbles. Okay, tap it. Okay, now we're going to clean our site, our white site. After we clean our white site, this is where we will be attaching our antibiotic. So clean, 15 seconds, throw, let it dry, okay? And then now we are going to attach our antibiotic. Twist and attach. Okay, so that's on your patient now. And then regulate slowly. We don't want this to infuse to your patient fast, especially with an antibiotic. Count for 1 full minute again, 100 drops, okay, per minute. So we're now regulating 100 drops per minute. Okay, there we go, slowly, 1 full minute. So once that finishes, your primary fluid starts to run and finish. Okay, so make sure you stay with your patient for a few minutes, document on the procedure, ask your patient, let them know if there's any adverse reactions to let you know. If there's an itching, check the IV site, check the patient every now and then, go in the room, doff your gloves, hand wash. Make sure, by the way, you label your antibiotic with this extra medication label. Okay, put it on your additional medication. All right, so that's it. Hand wash, check your patient, 6 rights of medication, very important, and keep your tubing clamped if not needed. Okay, and regulate that roller clamp slowly. Okay, so that concludes our video. Thank you so much, and have a great day. Bye.